Right, let's dive right in. Today, we're talking about something really fundamental: how to think like an ICU clinician. And this isn't just about memorizing facts from a textbook. It's about building a whole new mindset, a way of thinking that lets you handle the incredible pressure of critical care.
And this quote, it really says it all. In the ICU, time is a luxury you just don't have. A patient can be stable 1 minute and crashing the next. If you hesitate, if you freeze up, that can be the difference between a good outcome and a bad one. Thinking clearly when everything is going wrong isn't just a nice skill to have. It's everything.
So, what does that challenge actually feel like? Well, it's about stepping away from the clean, predictable world of books and into the messy, chaotic reality of a patient's bedside. This is where theory gets a serious reality check. Now, what's so important here is how these all connect. It's like a chain reaction, right? You have to think fast, for sure. But speed is totally useless if your assessment is wrong. And once you have that assessment, you've got to instantly prioritize what is going to kill this patient first. And then you have to act, not just randomly doing things, but moving forward with a clear, structured plan.
Okay, so this leads us to one of the biggest and most common mistakes people make when they're new to the ICU. I call it the number trap. And it's so easy to fall into, especially when you're surrounded by monitors all beeping and flashing at you.
And wow, this slide just lays it out perfectly. On the left, that's the trap. A monitor beeps, you see a number that's too low or too high, and your first instinct is just to fix that one number. But the goal, over on the right, is to see the whole patient. Let's say a heart rate alarm goes off. It's blaring. It says 130. The trap is to immediately grab a drug to slow the heart down. But the real goal is to ask why. Why is the heart rate 130? Is the patient in terrible pain? Are they bleeding somewhere you can't see? Are they septic? See the difference? One is treating a number, the other is treating a human being.
And that's the bottom line, really. That first flashy, scary number you see, it's usually just a symptom. It's a clue for sure, but it is not the root cause. If you start chasing that number without understanding the big picture, you can end up going down a completely wrong path.
This is exactly why trends are so important. A single blood pressure reading, that's like one frame in a movie. It gives you a little information, but the blood pressure trend over the last hour, that tells you the story. Is it staying steady? Is it slowly drifting down? Or is it falling off a cliff? The story, the real information is in the trend, not the snapshot.
So this brings us to the big aha moment, the real paradigm shift you have to make to thrive in the ICU. It's about getting away from just treating symptoms and moving toward understanding and supporting the body's fundamental systems. I want you to really let that sink in. The most important first step in any ICU emergency is not grabbing a syringe or turning up a machine. It's the moment of recognition inside your head. It's seeing the pattern and truly understanding what system in the patient's body is failing.
It does not start with a prescription. Just giving a drug without fully recognizing the underlying problem, that's like frying a plane blind. Yeah, you might get a number on the monitor to look better for a minute, but you could be completely missing the massive physiological collapse that's happening right under the surface.
And this is the core concept right here: failing physiology. This isn't about one lab value being a little off. This is about an entire system, like your whole circulatory system or your respiratory system, not being able to keep up with what the body needs. And when one system starts to fail, it creates this terrifying domino effect, pulling all the other systems down with it.
Honestly, if you remember one thing from this whole explainer, make it this. Emergencies in the ICU aren't really problems of a low potassium level or a high heart rate. At their core, they are problems of failing physiology. Your job is to figure out which system is failing and support it fast before that domino effect becomes impossible to stop.
So, how in the world do you do that when the pressure is on and chaos is everywhere? Well, you don't just rely on gut instinct. You can't. You rely on a method, a repeatable, structured approach that you can fall back on every single time.
And the reason for this is pretty simple, right? In the middle of an emergency, your brain is going to be jumping all over the place. Adrenaline's pumping. Without a structure to hold on to, you are pretty much guaranteed to miss something important. A structured approach is like your lifeline.
And here it is. This is the structure. And I want you to notice the order because it is absolutely critical. Step 1, you look at the patient. Your eyes on the person. What color is their skin? How are they breathing? Then, step 2, you look at the monitor to get the data. Step 3, you look at the trend of that data. Now, step 4 is maybe the most important. Stabilize first. That means you support the failing physiology right away. If they can't breathe, you give them oxygen. If their circulation is failing, you give them fluids. You deal with what will kill them in the next few minutes. And finally, step 5, you diagnose while you're treating. These aren't two separate events. They happen at the same time as you're working to keep that person alive.
So this isn't about being organized just for the sake of it. This whole method is built for speed and for safety. When you follow these steps every single time, you make sure you don't miss things. And that saves precious time, which, in the end, saves lives. It's as simple as that.
Okay, so we've talked about the mindset. We've laid out the method. So what's next? What's the very first practical tool you need to have in your toolbox to actually put all of this into practice?
I'll ask you to think about it for a second. If you could only learn one framework, one single process to handle a patient who is actively getting sicker right in front of your eyes, what would it be?
The answer is the ABCD approach. This is it. It's the practical, hands-on application of everything we just talked about. It's a structured way to assess and manage a patient's airway, breathing, circulation, disability, and exposure. And that is exactly what we're going to break down in our next explainer. I'll see you there.